Which of the following interventions is most likely to improve this patient's renal function and overall prognosis? Okay. 32-year-old woman with history of hypertension presents to the ED with sudden onset of severe abdominal pain, nausea, and vomiting. Pain started 3 days ago, has progressively worsened. She also reports dark urine, decreased urine output. Lab tests reveal anemia, thrombocytopenia, elevated liver enzymes. Kidney function is also impaired with increased serum creatinine and BUN. Abdominal CT shows bilateral renal hypoperfusion. Patient's blood pressure is difficult to control despite aggressive treatment. All right, so we want to improve her renal function and prognosis. Biggest thing is the hypertension, and it seems like bilateral hypoperfusion of her kidneys. Um, hmm. With really high those dark urine. I mean, she is urinating. Pain started 3 days ago. The thing is, if we do hemodialysis, then I thought I heard like once you start hemodialysis, you never stop. So I don't know if I'd want to start this. Um, I don't know what a peritoneal dialysis is. Um, renal transplant's really aggressive. Um, I don't know what steroids would do here. Hmm. Abdominal C, bilateral renal hypoperfusion. Blood pressure is difficult to control, so it's really high. She's having a lot of pain, nausea. Hmm. There's too much buildup of the BUN. Kidneys are not functioning. Blood's not getting to the kidneys. I don't know what a plasma exchange is or a peritoneal dialysis, but they seem less aggressive than hemodialysis or transplant. I
Okay.
mean, yeah, corticosteroids are almost never a bad choice, but I don't know if that's going to improve kidney functioning. Um, yeah, plasma exchange seems okay for some reason, but I really I don't know what this is. Um,
All right, let's kind of
okay,
see kind of what's going on here. So yeah,
okay,
plasma exchange. So hypertension, abdominal pain, right? Have all these kind of issues, consistent with thrombo microangiopathic or
okay,
atypical hemolytic uremic syndrome can be can be life threatening, of course, right? But plasma exchange, which can help remove kind of those factors and replace, certain proteins. But IV steroids not really good for HUS. Renal transplantation. I mean, in an acute setting, that's never gonna, you know what I mean? That's never gonna be an acute setting issue,
right.
right? Obviously, if the kidneys die, then you can think about it.
Yeah, that's a long-term thing. Yeah.
Yeah, and you're not gonna be able to find a kidney, right?
Nope.
So peritoneal dialysis, hemodialysis can use to manage, but usually doesn't treat the underlying cause. And
Okay.
like you said, thinking about what's aggressive, what's not. You're trying to pick something that fits here, but not super aggressive. But yeah, keep those in mind, right? Dialysis, is always a tool in your toolbox if your kidneys are shutting down.
Okay.
But plasma exchange is going to be the best answer here.
Is it true that once you start hemodialysis, you don't stop?
I don't think that's true.
Okay.
You don't quote me on that though, but
Okay.
I think like for instance, like giving you a scenario, if you have like really bad kidney damage and like, you have like really bad toxicity, then you can undergo hemodialysis and as your kidneys heal, then you can get off it.
Okay. 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 Yeah, because I think on vascular service, I just saw a bunch of patients who are on like 3 days hemodialysis and they don't urinate anymore. So it's like, okay, they're
Yeah, that's because like their kidneys are dead.
they're done. Okay. Okay. But it's
Yeah,
not, you don't like jump right to that. Like they were like CKD stage 4, stuff like that. Like that was a long-term issue. So,
exactly.
okay. But you could do hemodialysis like, yeah, actually, you're right. In ICU, I did see it being done in the hospital, like acutely. Okay, now that I think about it. Okay.
Yeah. Yeah, and it's just a tool, right? Hemodialysis and peritoneal dialysis, those are just tools to be able to function like your kidneys if your kidneys don't function right.
Okay.
And whether or not you do it long term or not, it just depends on if your kidneys are completely shot for good, then you're going to need long term dialysis, right? And
Okay.
if they're down right now, but slowly recover, then maybe in the future you don't need it, you know?
Okay.